81. The nurse should assess pupillary response in patients with head injuries. True or false? Answer. True. Rationale. Pupillary response, e.g., size, reactivity, indicates neurological status and increased intracranial pressure in head injuries, requiring frequent monitoring per assessment protocols. 82. Bell's palsy is caused by a bacterial infection. True or false? Answer. False. Rationale. Bell's palsy is often linked to viral infections, e.g., herpes simplex, or idiopathic causes, not bacteria, causing temporary facial paralysis, per pathophysiology. 83. Patients with epilepsy should avoid flashing lights. True or false? Answer. True. Rationale. Flashing lights can trigger seizures in photosensitive epilepsy, requiring patient education to avoid such stimuli, per epilepsy management guidelines. 84. The Glasgow Coma Scale is used to diagnose epilepsy. True or false? Answer. False. Rationale. The Glasgow Coma Scale assesses consciousness, not epilepsy, which is diagnosed with EEG and clinical history per diagnostic tools. 85. A patient with a spinal cord injury is at risk for pressure injuries. True or false? Answer. True. Rationale. Spinal cord injury patients have impaired sensation and mobility, increasing pressure injury risk, requiring frequent repositioning per wound care protocols. 86. Donepezil cures Alzheimer's disease. True or false? Answer. False. Rationale. Donepezil improves cognitive symptoms in Alzheimer's but does not cure the disease, which is progressive and incurable, per treatment guidelines. 87. The nurse should monitor for bradycardia in patients with increased intracranial pressure. True or false? Answer. True. Rationale. Bradycardia is part of Cushing's triad in increased intracranial pressure, indicating brain herniation risk, requiring urgent intervention, per neurological emergency protocols. 88. Trigeminal neuralgia is treated with muscle relaxants. True or false? Answer. False. Rationale. Trigeminal neuralgia is treated with anticonvulsants, e.g., carbamazepine or surgical interventions, not muscle relaxants, per treatment guidelines. 89. Smoking is a risk factor for stroke. True or false? Answer. True. Rationale. Smoking damages blood vessels and promotes clot formation, increasing stroke risk, making cessation critical, per American Stroke Association guidelines. 90. The nurse should place a patient with a seizure in a supine position. True or false? Answer. False. Rationale. During a seizure, patients should be placed in a side-lying position to maintain airway patency and prevent aspiration, per seizure management protocols. 91. Myasthenia gravis can cause ptosis. True or false? Answer. True. Rationale. Myasthenia gravis causes muscle weakness, including ocular muscles, leading to ptosis, drooping eyelids, a common early symptom, per clinical features. 92. All patients with traumatic brain injury require surgery. True or false? Answer. False. Rationale. Surgery is needed for some traumatic brain injuries, e.g., hematomas, but others are managed conservatively with monitoring and medications, per neurotrauma protocols. 93. The nurse should teach fall prevention to patients with Parkinson's disease. True or false? Answer. True. Rationale. Parkinson's disease causes balance and gait issues, increasing fall risk, requiring patient education on safety measures, per nursing care plans. 94. Meningitis is always fatal without treatment. True or false? Answer. False. Rationale. While bacterial meningitis can be fatal without prompt antibiotics, viral meningitis is often self-limiting and outcomes vary per clinical management. 95. The Babinski reflex is normal in infants but abnormal in adults. True or false? Answer. True. Rationale. A positive Babinski reflex is normal in infants due to immature nervous systems, but indicates neurological dysfunction in adults, per assessment standards. 96. Anticonvulsants are safe for all patients with epilepsy. True or false? Answer. False. Rationale. Anticonvulsants have side effects, e.g., liver toxicity, rash, and interactions, requiring individualized selection and monitoring, per pharmacology principles. 97. A patient with a stroke should be assessed for dysphagia before oral intake. True or false? Answer: true rationale. Stroke can cause dysphagia, increasing aspiration risk, requiring a swallowing assessment before oral intake, per stroke care protocols. 98. Huntington's disease is diagnosed through a blood test. True or false? Answer: true rationale. Huntington's disease is diagnosed via genetic testing, blood test, for the Huntington gene mutation, confirming the diagnosis, per diagnostic criteria. 99. Aging decreases the brain's ability to repair after injury. True or false? Answer: true rationale. Aging reduces neuroplasticity and repair mechanisms, increasing recovery time and complications after brain injury, per neurological changes in aging. 100. The nurse should administer sedatives to all patients with migraines. True or false? Answer: false rationale. Sedatives are not standard for migraines, which are treated with triptans, NSAIDs, or non-pharmacologic measures, depending on severity, per migraine guidelines. 101. The nurse should assess for hemiparesis in a patient with a suspected stroke. True or false? Answer: true rationale. Hemiparesis, weakness on one side of the body, is a common stroke symptom due to damage in the contralateral brain hemisphere, requiring immediate assessment, per stroke protocols. 102. Parkinson's disease is primarily treated with antibiotics. True or false? Answer: false rationale. Parkinson's disease is treated with dopaminergic medications like levodopa, not antibiotics, which are used for infections, per treatment guidelines. 103. A patient with epilepsy should be taught to take anticonvulsants consistently. True or false? Answer: true rationale. Consistent anticonvulsant use maintains therapeutic levels, preventing seizures, and requires patient education on adherence, per epilepsy management guidelines. 104. The Glasgow Coma Scale is used to monitor cognitive decline in Alzheimer's disease. True or false? Answer: false rationale. The Glasgow Coma Scale assesses acute consciousness, not cognitive decline, which is monitored with tools like the Mini-Mental State Examination in Alzheimer's, per assessment standards. 105. Multiple sclerosis can cause spasticity in the limbs. True or false? Answer: true rationale. Multiple sclerosis damages upper motor neurons, causing spasticity, muscle stiffness, in the limbs, managed with medications like baclofen, per clinical features. 106. All patients with traumatic brain injury develop seizures. True or false? Answer: false rationale. While traumatic brain injury increases seizure risk, not all patients develop seizures, with prophylactic anticonvulsants used in high-risk cases, per neurotrauma protocols. 107. A lumbar puncture can diagnose meningitis. True or false? Answer: true rationale. A lumbar puncture analyzes cerebrospinal fluid for infection markers, e.g., bacteria, glucose levels, confirming meningitis, per diagnostic criteria. 108. The nurse should administer insulin to a patient with a stroke. True or false? Answer: false rationale. Insulin is used for hyperglycemia, not stroke directly. Stroke management focuses on thrombolytics or supportive care, per American Stroke Association guidelines. 109. Myasthenia gravis can cause difficulty swallowing. True or false? Answer: true rationale. Myasthenia gravis weakens pharyngeal muscles, causing dysphagia, increasing aspiration risk, and requiring swallowing precautions, per clinical presentation. 110. Alzheimer's disease is caused by a single genetic mutation. True or false? Answer: false rationale. Alzheimer's disease has multiple causes, including genetic, e.g., APO gene, environmental, and lifestyle factors, not a single mutation, per pathophysiology. 111. The nurse should monitor for respiratory distress in patients with Guillain-Barré syndrome. True or false? Answer: true rationale. Guillain-Barré syndrome can weaken respiratory muscles, causing distress or failure, requiring close monitoring and potential ventilation, per nursing care plans. 112. All migraines require imaging for diagnosis. True or false? Answer: false rationale. Migraines are diagnosed clinically based on history and symptoms. Imaging is used only to rule out other causes, e.g., tumors, per diagnostic guidelines. 113. Increased intracranial pressure can cause pupil dilation. True or false? Answer: true. Rationale: increased intracranial pressure compresses cranial nerves, causing unilateral or bilateral pupil dilation, a sign of herniation, per neurological emergency protocols. 114. The nurse should restrain a patient with Parkinson's disease to prevent falls. True or false? Answer: false. Rationale: restraints increase fall risk and agitation in Parkinson's patients. Assistive devices and environmental modifications are preferred, per safety protocols. 115. Seizures can be triggered by sleep deprivation. True or false? Answer: true. Rationale: sleep deprivation lowers the seizure threshold, triggering seizures in susceptible patients, requiring education on sleep hygiene, per epilepsy management guidelines. 116. Bell's palsy affects both sides of the face simultaneously. True or false? Answer: false. Rationale: Bell's palsy typically affects one side of the face, causing unilateral paralysis due to cranial nerve 7 dysfunction, per clinical features. 117. The nurse should assess for confusion in patients with meningitis. True or false? Answer: true. Rationale: meningitis causes inflammation of the meninges, leading to confusion, irritability, or altered mental status, requiring neurological assessment, per nursing care standards. 118. Huntington's disease is treated with cholinesterase inhibitors. True or false? Answer: false. Rationale: Huntington's disease is managed symptomatically, e.g., antipsychotics for chorea, not with cholinesterase inhibitors, which are used for Alzheimer's, per treatment guidelines. 119. Peripheral neuropathy increases the risk of foot ulcers. True or false? Answer: true. Rationale: peripheral neuropathy causes loss of sensation, increasing the risk of unnoticed injuries and foot ulcers, especially in diabetes, requiring foot care education, per nursing protocols. 120. All stroke patients experience complete recovery within 1 month. True or false? Answer: false. Rationale: stroke recovery varies. Some patients have permanent deficits, while others recover partially or fully over months, depending on severity, per stroke rehabilitation guidelines.